You're all grown up now, but a childhood virus could come back to haunt you. Dr. James Campbell is here to connect the dots between your childhood chickenpox and the painful adult affliction of shingles. Geriatrician Dr. Campbell hangs his shingle at Metro Health. Thanks for joining us.
Thank you.
It's so good to see you again.
Good to see you.
Dr. Campbell, tell us what's shingles.
Basically, the chickenpox virus that you had as a kid goes into a dormant phase in your nervous system. Sits there for 50, 60 years, and then the risk is that that virus reactivates and causes a rash that also has a pain component that usually is on one side of your body, usually follows the path of the nerve. It's a very interesting rash, very distinctive rash. We work very hard with trying to make sure that people who have this type of painful rash come to see their physician quickly, because if we can
How quickly? When do you need to know?
You really need to get on the antiviral medication within 72 hours in order for you to have the maximum effectiveness of that. And the other thing we want to talk about is the fact there now is an immunization. There's now a vaccine that helps to prevent people from getting shingles.
So just so I can clarify, you had chickenpox. The chickenpox is long gone, but you can still get shingles 50 years later.
Right. Because it didn't really totally go away. It just went to sleep deep down inside you.
All of us that had chickenpox as kids are at risk.
Yep. And it's more common after the age of 60, and then as you get older, it becomes more likely that it'll have a chance to come back.
All right. So we get shingles. How do we get rid of it?
Well, we can get rid of it. Mostly your body heals itself. But we do have medication that it works against the shingles virus, that if we can get you started on that medication within the first 3 days of your symptoms, that will shorten the course of the disease and make it less likely that you have a chronic pain syndrome as a result of having the shingles. That's what we call post-herpetic neuralgia.
And the first symptoms that appear in the first 3 days, those are pain?
You oftentimes start with pain before the rash. Interestingly, sort of in a one-sided area, one part of your body. It's been mistaken from everything from gallbladder cholecystitis to a myocardial infarction. It really depends on what part of your body is involved as to what it can imitate. But then, bing, all of a sudden, a day or so later, a rash starts to appear there. That's the giveaway.
So when you see the rash, if not sooner, get to the doctor.
Get right to the doctor.
And a vaccine, you said that there's actually a vaccine now to prevent the shingles?
Yeah, the vaccine is now recommended by the Centers for Disease Control for everyone over the age of 60. It's a live vaccine that it decreases your chance of getting shingles by 50%. So it's not perfect. It doesn't say, you take this and we've prevented you from ever getting this disease. But if you've talked to people who've had shingles, or worse yet, who've had the post-shingles pain syndrome, they would say, boy, if I could have a shot that would make it 50% less likely I would have had to live through that, I would take it.
Any side effects on the vaccine?
You have to be a little careful about how you get it so that you don't have a financial side effect. Okay? It's the most expensive, currently recommended vaccine that's out there. And there's you just have to work with your physician around what your insurance coverage is,
make sure you can get it covered.
Sometimes the shot itself has to be paid by your drug insurance, and the administration of the shot has to be paid by your medical insurance, and it varies policy to policy.
Thank you, Doctor. Always great information. Great to have you on again.
Yeah, it's nice to see you.
We can't completely shake off your chances of getting shingles, but early detection can ease its onset, and now you can prevent it, or at least have a 50% chance of preventing it if you get the vaccination. To learn more, give Metro Health a call. The number's coming up next. My thanks to Dr. Campbell for joining us today.
For more information, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, a house is not always a home.